Welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. Our guest is Bonnie Addario. She's been an activist, advocate, educator, and change agent, empowering patients and giving them a voice in the fight against lung cancer ever since she received her stage 3 diagnosis more than a decade ago. And she's joining us today to talk about the tALK Positive initiative. Welcome to Health Professional Radio, Bonnie. How are you?
Well, thank you. I am awesome, just awesome, and happy to be with you. The tALK initiative is a project really, really close to my heart because I think most people out there believe that lung cancer, is one cancer, and it's not. It's many cancers. It's many different types of cancer, all mixed into that heading, and it is not one size fits all. There is not one drug that all lung cancer patients can take to be well. It's many. And the ALK fusion, which is the last half of tALK initiative, is one of those mutations that is a driver of one type of lung cancer. And Takeda, we're partnering with Takeda Pharmaceuticals because they have just received recently in April of this month, I think April 17th, an accelerated approval for yet another therapy for people with this ALK fusion. The first one was crizotinib. So this drug that Takeda has is one that people can take second line if they've either progressed in their cancer on the first therapy or they have become resistant to it. So it's very exciting times for lung cancer. The ALK fusion is only one of the many mutations that have a targeted drug. I think there are 11 now with targets for first line, second line, and beyond, and hopefully on our way to chronically managing this disease at some point in time.
How have you been doing with managing your situation? And how many folks are there who are suffering from the same type of lung cancer that you've combated?
Well, interestingly enough, I don't know my mutation. I was diagnosed over 13 years ago, and this wasn't even being done. There was one marker in a clinical trial at the time and one targeted drug. Now there are, many and counting. We didn't know 13 years ago that lung cancer was so many different kinds. So, these are such positive days for lung cancer. And, I am convinced we are looking to many, many, many more different drivers and different therapies. I was lucky enough to be able to, the tumor I had was on my heart, and I was able to have some very toxic chemotherapy at the time and radiation, and very fortunately was able to have surgery. That really isn't a standard of care for lung cancer. The standard of care is getting comprehensive genomic profiling upon diagnosis to find out exactly what's driving your cancer. Again, it's not one size fits all. Everybody has a specific identifying marker, genomic marker, that allows us to give you absolutely the best therapy possible for your cancer.
It is Lung Cancer Awareness Month, and you obviously are doing your part and above to, raise awareness about this specific type of cancer and some of the groundbreaking research and treatments that are available. When it comes to awareness, would you say that this awareness is going to affect distribution of some of these drugs, whereas many of these patients and some of the practitioners still may not be up to speed as far as the markers, the different types of cancers, and the different types of treatments available?
Absolutely. Right now, probably only 30% of newly diagnosed patients with lung cancer are getting comprehensive genomic profiling. And that needs to grow in a huge way for us to really start changing the survival rate for lung cancer. The survival rate is still only 18%. When I was diagnosed 13 years ago, it was 15.25%. It's not growing fast enough, and especially in the community, we need physicians to immediately, upon diagnosis, make sure the patient has the genomic profiling so we can identify the target and hit it hard.
In your own situation, talk a bit about the psychological aspect of realizing that there are these treatments out there after having maybe been told the traditional treatments were the only ones out there. I'm sure that spirits are lifted when you're raising awareness and talking to some of these people who never had a clue, but now they're on a different path toward recovery.
Well, you're exactly right. And in 1971, Richard Nixon declared war on cancer, but the war on lung cancer is just now getting started. And it's a beautiful thing. It used to be, if you were diagnosed with lung cancer, you kind of fell into a dark hole, and there were only one or two potential therapies out there. And when they stopped working, it was over for you. Now the future is so much brighter. And Takeda is one of the leaders in making that happen. So this whole month for November and lung cancer awareness, we have been talking about nothing but these new initiatives and how important they are. We need to know. Imagine a bus going down the road and one driver gets off and another driver gets on. Makes sense.
Talk about the social media aspect of the Talk Positive initiative. How are we going to get listeners involved via social media?
Well, it's actually awesome. And, patients are becoming so much more educated now with social media. They at times know more about their cancer before they even have a discussion with their physician. So patients can follow Takeda on Facebook, Twitter, and Instagram. They can also get into livingwithalk.com/ALK positive to learn all the facts about their particular ALK-driven disease and actually take that information back to their physician and say, hey, what about this for me? It looks to me like I qualify for this therapy.
The donation goes to the Bonnie J. Addario Lung Cancer Foundation. Is that correct?
That's correct. Every time a patient gets involved in any one of those venues, Takeda makes a donation to our foundation, which we use for patient programs and research as well.
Now, where can we get some more information about Takeda?
Takeda would be livingwithalk.com, or you can go to Takeda Oncology.
It's been a pleasure, Bonnie. Thank you so much for taking the time today.
You're welcome. Thank you. Thank you for spreading the word.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at healthprofessionalradio.com.au and hpr.fm.